Hello, this is Kelly McLendon, Managing Director of CompliancePro Solutions. And this continues with our series Hot Topics, HIPAA and Information Blocking. The 21st Century Cures Act, which is the ONC, or the Office of the National Coordinator of Healthcare IT, information blocking, and the CMS, that's Medicare, interoperability and patient access rules, are new federal rules that are implementing Monday, April 5th, 2021. These rules are designed to give patients and their healthcare providers secure access to health information. That's the basis for why they are putting these rules in place. The rules came from a part of the 21st Century Cures Act, which was passed at the end of the Obama administration. It was a very large bill with many parts. Part of what they had to bring to the table was this information blocking and interoperability and patient access set of rules. They used the Office of National Coordinator of Healthcare IT, ONC, and CMS Medicare to bring these rules to the table. They are all working together and they work along with HIPAA. These rules call on the healthcare industry to adopt standardized APIs, which are application programming interfaces. That's ways in which computer systems and databases talk to each other, which will help allow individuals to securely and easily access their electronic health information using, for example, smartphone third-party applications. There are all types of applications that may use these APIs to get access to the patient information, but we're concentrating to begin with on the patient and them getting access to their own information and directing where that information can go. It involves providers of care, health IT developers, and policymakers. The 21st Century Cure Act is in the process of being implemented, and HIPAA is being modified in order to facilitate these patient access requirements that allow patients to access their own protected health information, or electronic health information as it's now called under the information blocking rules, and to facilitate other supporting data exchanges. Again, it's key to give patients access to their own information. All workforce members in healthcare organizations must strive to place a focus of your attention on streamlining and improving patients' access to their own information. There's a thought out there by many people that healthcare providers actually impede the flow of information to patients. We need to make sure that that is not, in fact, the case. Patients and our workforce members will continue to use the same processes for patient access, disclosure, and exchange of their information, but increased regulations and enforcement timeframes for access or copies, along with the new information blocking exceptions, will introduce some variations into those processes that will then facilitate the patient hopefully having more control of their own information. So while we're basically keeping the processes in place that we're using to respond for patients' request for information, there will be some variations. Things like offering a patient portal for them to get their information in, and allowing from within that portal to direct the information to be sent to places. And then if you're not going to give information out, invoking an information blocking exception are some of the variations that we're going to have to work on with the processes of getting patients their information. Hopefully, the law will spur the patient to get their own information as much as possible and have that provided through something like a patient portal. Of course, all impacted workforce members in your organization will have to be trained on any variations of the policies and the new rules if they're impacted by them. Know for sure that this is not going anywhere other than to be implemented with enforcement, because it's a part of the Health and Human Services Regulatory Sprint to Coordinated Care initiative and Office for Civil Rights HIPAA's Patient Access Initiative, where they're now finding and investigating and putting penalties out there for organizations that do not provide record copies appropriately. They've even created a logo for the regulatory sprint to coordinated care, focusing on getting enough information to coordinate care between providers. That's getting the information from the patient in the hands of people that need it to help care for the patient. That's it for today. Thank you for your attendance. And as always, feel free to reach out and contact me if you have further questions.